We're going to talk about risk management and drug testing in clinical practice. The evidence supporting the use of urine drug testing in clinical circumstances is limited. Some studies show that primary care physicians, family physicians, other clinicians with limited training in pain management may not fully understand the uses, the limitations, and potential pitfalls associated with the use of urine drug testing in practice. However, urine drug testing can be an effective part of opioid treatment when applied effectively and correctly interpreted. So in this segment, we're going to discuss the concept of risk management in patients on chronic opioid therapy while we review the strengths and limitations of urine drug testing for monitoring adherence to therapy and for the detection of illicit or unprescribed drug use. We're also going to discuss the physician-patient relationship in the context of urine drug testing. So, what are some of the warning signs, the red flags that clinicians can look for to help identify aberrant behavior in pain patients?
Well, I think there's both biological, psychological, and social type indicators that you need to keep top of mind when we're looking at patients who may be more susceptible to a non-medical use of opioid prescriptions. Those include a personal or family history of alcohol or substance abuse, a personal or family history of mental disorders like major depressive syndrome, as well as other types of indicators have been looked at, whether or not they're chronic smokers, whether or not they've, if they've had a previous history of sexual abuse in their teen years. In the literature, there's some soft and hard indicators that we need to be aware of when we apply universal precautions for these types of patients. And then there's also other issues related to how the patient presents. If they're saying they've lost their medication, or they want their office visits at 4 o'clock on Fridays, because that's when maybe everyone wants to just get out of the office real quick. Things to this effect are important.
So we're talking about stratifying patients, right, as being at low or high risk for opioid abuse or misuse, and that's what you were talking about. So talking about screening tools, some strategies you can use to evaluate patients, or is it all sort of the same mix?
No, I think, again, I think you want to use different types of, like the opioid risk tool. You would like to use the CAGE, you'd like to use the 4A's. There are different ways that you can use what I like to term a comprehensive compliance monitoring program. One of those is urine drug testing. I think what we have to be cognizant about urine drug testing is there are pros and cons to it, and that it is costly and can be costly to our patients as well. Sometimes urine drug testing can cost as much, if not more, than an MRI. And I think Jeff had mentioned that patients like to get MRIs. It's very difficult sometimes to do a procedure, get an MRI for that, and then 6 months later get an MRI just to see how things went. But with urine drug testing, it's not uncommon to have even some state boards say, we want you to drug test 3 times a year. So I think we have to add it into the whole entire comprehensive monitoring program, which includes educating your patient, which includes asking CALs, using other tools like the clinical opioid withdrawal scales, et cetera, et cetera.